I saw this stretch for the low back pop up on, you know what, I don't want to get anyone in trouble, so I won't even say it. But it looked like a really good teaching point for long leverage, and we don't have enough of those, so hey, this is awesome, frankly, real good. So the stretch or the position involved laying on your back in what you call the supine position. That's what we call that technical term. Don't worry about it. In any case, a foam roller or something like that, as a technical term, we often just call this a fixed point in the manual therapy world. It was put underneath the low back lumbar spine. And what this does is essentially prop this area up. It pushes it forward, quote unquote, relative forward, relative to this position. And so when you do that, you do have to understand you're doing it for a reason. There's a structural reason why you would even want to do that. And usually it's because it lacks forward position. It's flat or flexed, we call that. And so by putting this thing there, not pushing too hard on it, by putting this thing here, we create a more normal curve to that area of the spine. That's what it's supposed to look like. This is a really simplified look at the lumbar spine, and this is when it's become flat or its relative flexion. You can't see my fingers, but they're air quoting. And so when we create that fixed point, when we push up on that spine, that area of the spine, safely, reasonably gently, what we can do is establish a more normal curve, a more natural curve to the area. So we get that extension curve that we're looking for. That's what we're going for. And understand as well, when we push up like this, we extend the front. We lengthen the front along with it, and that could be your anterior longitudinal ligament that runs along the front of the vertebrae. It could be your rectus abdominis, which would be way further away, but somewhere around there. And we lengthen the tissues. Hey, got to mention the psoas, of course, but we lengthen the tissues that are restricting it from being in this relatively normal position. And you got to do it right. You got to do it intelligently, and you got to know that it's there to actually work on it. You actually got to figure out if it's there at all. And that's when you actually want to do something about it. Find a professional. Not me, personally. I don't really know any of this stuff. I'm just reading a script. My real passion is cat names, frankly. I have a blog, Cleocatra, Meow Reese, the Rocket Richard, Spindly Gibson. So, in this exercise, in this stretch, they also accentuated it by bringing the arms up. And ultimately what this allowed for, was furthering the leverage. What you have to understand too is with the position of the thorax, with bringing the arms up, so we bring the arms up like so, you call this shoulder flexion, that's this joint here. Though there are other things involved, we pull through the thorax and the pelvis, and we go from what is a neutral position to more of an extended position overall, and this increases the arch. This pulls through, in fact. So not only does the arm come up, not only does the lumbar spine get a better curve to it, but we also get a pulling back on the thorax and a tipping, you say, anterior of the pelvis. And this is kind of a cool effect. Again, we're lengthening this front line here. We're going this way, essentially, with it. That's the idea, that this actually assists the whole process in happening. And of course, it happens because of shared tissues. So we've got, for instance, a scapula here. It's one of the attachments. And we can attach from the shoulder itself, humerus, to get technical, into that scapula with the deltoid. And of course, from that scapula, we have other muscles. We might have our trapezius upper and lower fibers. We'll have our rhomboids attaching to the actual thoracic spine. And then if we start to look through the front too, we've even got a pec minor muscle and a pec major muscle. And as we bring this arm up, all of these muscles get pulled through, and generally they pull forwards and up. Forwards up relative to this position, but forwards and up, ultimately tipping that thorax up, ultimately propping up or pushing or pulling, really pulling, but pulling up this part and further adding to the extension in this area. And of course we have to be safe and gentle with this. We have to be smart about the way we do this, but it adds to the full body integration of the maneuver. And this is what I saw in this particular exercise. A smart way of doing it. I wanted to add just another way, and I'm not suggesting you do this. I'm suggesting you see a professional, as always, figure this out for you, whether it needs to be done and how it should be done properly. But to add to that idea of leverage, we can also go through the other part of the body, through the lower limb or the legs. When we bring the legs up, it's not going to have a huge effect on the pelvis. Remember, we actually want to get this tipped a little bit forward. It adds to the propping up of this lower part of that arch. But at the same time, we can accentuate exactly where that leverage is going to. So bringing the knees up doesn't necessarily do anything, but it does allow the legs to swing back and forth in the transverse plane. So an axis like that running through it, and we're just bringing our knees left and right. I made it way more complicated than it needs to be. But if we bring our legs left and right, we can pull through, again, muscles, fascial tissues, through the joints themselves. So whether that's the hamstrings or the quadriceps, we can pull from the knee into the pelvis and then into the vertebrae themselves that need the actual mobility increase. Again, we're doing this because it's stuck in a position it shouldn't be. So this is a vertebrae from an inferior view, transverse plane cut. So we're looking at it from the bottom up. The legs would be pulling from roughly these directions. The muscles would be attaching through here, and we'd have like our erector spinae, our deep intrinsic muscles pulling in this orientation. I'm going to try and not overcomplicate it. The QLs would be coming off the TVPs, and then the psoas would be coming from right in around there, just for clarity's sake. Of course, you have multiple joints. Let me just get this all cleared up a bit too. Multiple joints in the form of the vertebral body, vertebra to vertebra. And then, of course, you have a few facet joints here as well. And this is the areas that they actually get stuck and rigid, along with the ligaments. So anterior longitudinal, posterior longitudinal, all that stuff. Interspinous. So when we change the position of those legs, when we pull through, let's say, again, we're looking at this from the bottom up. When I pull my legs towards the left, I get a pull in this direction. Hopefully you're following along. It gets a pull in this direction, which means the vertebra, because of that, tends to spin this way. Again, remember, we've got a fixed point somewhere in around here. We've got it, the foam roller, or that fixed point. It's a hand, it's a board of wood, hopefully that's not too painful. But anyway, it's got a fixed point. It starts to concentrate it. It means this facet is pulled down, this is pulled up. We can call that a rotation. It's not going to be huge in the lumbar spine. It's only going to be a little, but it allows for just a little bit of left-right motion, and it reverses, it flip-flops, all thing flip-flops when we go the other way. And now it's being pulled down on this side and up on this side, and let's not make that overly complicated. But it extends the leverage. The leverage becomes longer than it was before, and it's by these simple motions. And it's pretty cool, I think. Anyway, Simple Lines Anatomy has been Elge. Hey.